My name is Eliza Lopez, and currently I'm an outreach intern for neolth, and I've actually been at neolth for a couple of years. I joined in September of 2020, so I believe this year is going to be the third year that I'm like doing various like activities and participating in the subcommittees and other types of advocacy work. So it's been really cool to kind of collaborate with other people, just like the ones on this call, to just continue amplifying like youth voices and continuing to make sure that all youth and just people in general have like more involvement in the mental health movement. So I'm really excited to introduce you all and kind of provide more insight into how technology has been able to intersect with mental health, along with its current implications and how it'll continue to unfold in the future. So I'll just go on right ahead and start talking about the many different aspects and qualities that technology has within the mental health movement. So since I consider this topic to be fairly multidimensional, I decided to really just make it more digestible for everyone by dividing this topic into three essential qualities. So the first one here is how technology and things like social media has been able to amplify, as I said, youth voices and expand more on digital campaigns to make sure that a lot of the activities and advocacy that we're doing is reaching as many audiences as possible. And because of the accessible and swift networks of things like the internet and just online platforms in general, and things like even like smartphone apps, we're able to make sure that this work that we do reaches as many areas around the globe as possible. So as I kind of implied, technology and mental health does intersect into things like social media. And because of how expansive this field is, we kind of see it as a double-edged sword, just because it brings so many advantages as well as disadvantages at the same time, with how it can affect not only individuals' mental wellness, but also just their social dynamics and their behavioral health. And thirdly, we have virtual treatment. So how can platforms be a good way of support for mental wellness? You know, like, although it is not a complete substitute to things like interacting with a provider, we can see that it is proven to be a really good supplement for improving your mental wellness and just making sure that your routine or just the way you're feeling and other aspects like that are consistent and on track. So before I go into this, I firstly wanted to share some digital healthcare youth perspectives, just because I think it's really important, with youth and Generation Z being that rising generation and really taking part in the mental health advocacy movement. I think it's really critical to kind of share the insights and thoughts that young people have towards how digital care and how things like social media and online information will really keep revolutionizing the movement. So on the left over here, we can see that there's a chart about the amount of health information that youth have acquired from the internet. And this data was taken from a center at Northwestern University. So as you can see by the percentages here and how everything is divided up, we can see that the highest percentage, so 37.1%, this number represents the amount of individuals that say that they have acquired some information about their health over the internet. But we can also see that the second highest percentage report that individuals have sought the internet to for a lot of health information, and another large percentage of people have also sought the internet for even just acquiring a little information. So this ultimately amounts to 84% of youth obtaining some form of health information online. And we can see that this actually surpasses the amount of youth that refer to other platforms, such as like books and like other articles that aren't digital, in the health information that they desire and will ultimately digest. So kind of dividing this percentage even more, we can see that 21% of the youth in the group that was surveyed by Northwestern, they actually downloaded at least one health-related app. And kind of supplementing that, we can see that 12% of them tried a health-related game. So again, it may also be overlapped with like an app. And 7% of these individuals also invested in a wearable. So those are essentially like health and like digital tools and devices that you may wear on, for example, like your wrist, to keep track of certain levels throughout the day that relate to your health. And for the last statistic here, we can see that 32% of the youth surveyed reported a significant change in their typical behaviors or the routines that they maintained throughout the day. And this was actually as a result of online health information. And 28%, just as like representing that group, they reported that the change that they implemented was health related. So you can see that with over a quarter of youth implementing some kind of change, digital platforms and things like social media obviously do have a substantial effect on how we go about our daily lives and even just our behavioral and social impacts. So I actually wanted to talk to you guys about some student accounts here and really just diving more into various perspectives that Generation Z has on youth mental health and how it relates to technology, really how it pertains to like their everyday lifestyles and how they think that it will continue to develop in the future and other implications like that. So as we can see here, one of our ambassadors mentioned that social media affects their mental health by making them seem like people have to model this perfect person who is conventionally healthy, wealthy, popular, and has no mental health conditions such as anxiety or depression. So for them, it really just created that idea in their mind, as well as their peers that they observed, that in order to have this ideal image and this cookie cutter image, that one must be like those that are demonstrated in platforms like social media. So a lot of platforms that you guys may have heard about that obviously have created this effect, maybe Instagram, Twitter, Snapchat, etc. And additionally, on a positive note, because as I mentioned, social media can be that double-edged sword, it has also helped this ambassador to connect and meet with many others that are just like themselves and live in similar situations and backgrounds as well. And because of that, it's really helped to promote that community and inclusive space. But obviously, as I said, because mental health and technology, we can see that it is such a double-edged sword. This person also stated that they had concerns about mental health platforms online because they could possibly lead towards the direction of self-diagnosing for certain conditions. And obviously, this can only be achieved by consulting with a provider. So they said that although it's critical to understand the nature of these disorders and how people may thrive in those kinds of environments, it really isn't as ideal if that information is communicated in a formal way. They think that it's also good to kind of develop that connection by also saying it in a conversational manner. And they also thought that their peers, as well as themselves, can use technology to help progress the mental health movement by allowing more information and advocacy to really be leveraged even more. So really just to maximize like the current resources that we have by also transferring that to an online platform, because as I mentioned, the swift networks of technology and just the internet in general can really help to disseminate information in a way that is effective and quick. And for them, they also stated that some personal experiences that they had were in finding effective stress management techniques using the variety of resources that are offered online, as well as through apps, as well as ways to control their impulsivity. So I also wanted to talk briefly about what this second student said. So they actually referred to neolth as a really good platform that they utilize throughout the day to really just make sure that their routine is on track and to make sure that their mental health like practices are going as they should. So they said that they start off their day with meditation using the app, and they really try to like hone in on different techniques that really help to enhance certain parts of their well-being. So this could be things like breathing and helping to clear their mind to make sure that they're all set for the day. And they said that they're also making the effort to implement these types of mental health resources even throughout the day. So they said that between classes, or if they have a free period, then they'll do a quick 5-minute meditation with the neolth app in order to recenter themselves and make sure that they feel grounded and in the right headspace. And they said it's also beneficial for them to take a short break to check in with their emotions because it'll keep them from feeling overwhelmed throughout the day. And obviously, this is a really good practice for them to make sure that everything is in check. And it's also good that they're mentioning that they're taking use of different resources in order to, you know, like supplement their well-being and again, make sure that their feelings and other emotions are in check. They also concluded with the fact that at night they also use neolth as part of their sleep routine to also take part in meditations after a long day. So this is also a good way for them to kind of resolve the stress that they've maybe like accumulated throughout the day. And they also said that quieting their thoughts before bed has also improved their sleep quality, which I personally think also just attests to the fact that mental health is also very connected with other aspects of your health, such as physical health. So I say it is pretty beneficial for the student to take part in practices that work best for them, especially using the neolth app, because it also has improved their lifestyle in multiple ways. As for our third student account, I thought as I was reading this that it had a lot of similarities and overlaps with some of the past two accounts. So they said that they've gained both advantages and disadvantages from using social media, which is just an example of one of the many digital platforms that mental health is connected with. So they said that through these platforms, they've really helped to enhance their social and support systems by making new friends across the globe. So you can see that digital platforms have obviously impacted their mental health by fostering that sense of community and them being more reassured that they have even more of a support system. And because of it, it gives her a sense of belonging, and it makes her feel that she is accepted as part of a group. And she also took the effort to talk more about the other side of digital health and mental wellness by talking about her screen time. So she feels that after making a lot of these different accounts on social media, at the end of the day, she sees that it can tire her out, or it can probably like make her feel irritated about some content that she witnesses online. And she's also observed in herself and other peers that people may compare themselves to other influences on social media and may even feel bad about themselves as a result. And it has been something that she has personally encountered a few times, which has affected her self-esteem and self-worth. And lastly, this student account said that for instances such as the pandemic, when people had become more tired or depressed, she said that technology was really a way to kind of bridge those gaps between people and make sure that that connection was still maintained. And yeah, basically just saying through the different activities that she mentioned in the last paragraph, through YouTube and like classes and playing online games, that of course this fostered a sense of community, which in turn would also be really beneficial for the students' mental health. So I kind of wanted to give like a recap of the different student experiences and why I even wanted to bring them up in the first place. So you can see that for the pros here, two of the overarching things that I really caught on to were the fact that these ambassadors or these students were able to forge human connections with each other as a result of digital platforms, which in turn could positively affect their mental health. And secondly, we have that they were also able to access different exercises and practices, especially with the neolth app, to really help them maintain this state. And as for the cons, I also wanted to mention that we've extracted quite a few. So we can see that social media and other platforms have contributed to the creation of unrealistic or false expectations. You know, they mentioned that they feel like they have to fulfill a version of someone that they've seen online in order to feel that they were more fulfilled or to paint them as a more ideal person. And as for the second con here, we can see that these students also mentioned that they feel like they have to compare themselves to other peers and users. And because of this, they may feel that they are not as deserving, or they may not be like on the same level as other people, which can negatively affect their mental health. So as you can see here, digital platforms and things like social media obviously do have a substantial effect on our mental wellness and just the way we go about our everyday lives. So I also wanted to touch briefly on some online mediums that are really connected to the mental health movement, whether that's in treatment, doing different exercises, or even taking part in the mental health advocacy movements and campaigns. So as it says here, as the movement branches off to and also includes a variety of backgrounds and areas around the globe, virtual platforms have also proved to accelerate this kind of advocacy work and expand outreach to as many populations as possible. So the first one I listed here was educational material, and this can simply take form in things like articles or just informational material about like different mental health conditions, or it could also be different like students' lived experiences, and things like that. So it's been really accessible because of the internet. You know, it kind of like has been able to house these different information, statistics, and resources that people can use, not only just to inform themselves, but it has also been really beneficial for things like research and creating things like infographics on social media and other platforms that have a high viewership. So the second one I have here is hotlines and databases. So a popular hotline that many people know of in the US is the 988 hotline, and some examples of databases that have been made for the sake of mental health resource accessibility have included things like therapists. You know, there have been like a lot of identity-based like databases to make sure that people are accessing and can be in contact with different therapists, providers, and other resources that best accommodate their identity and their preferences. And yeah, there are a lot of resources when it comes to things like that. Another one I have here is forming alliances and coalitions, you know, for different clubs that have, or different organizations that have a really big online presence. They've also been able to establish these different alliances, clubs, and coalitions in a lot of different states and even countries. So one that really comes to mind here is Active Minds, and they haven't been able to just establish themselves in things like schools and other institutions, but they are pretty on top of creating and releasing different resources and articles for online users to refer to as well. So another one that we have here is creating campaigns and petitions, really just to advocate for like a certain like mental health related issue in one's community. And the campaigns have also been really successful, even in platforms like social media, because it has been able to be disseminated through social media platforms like Instagram, as you'll see, is a really big one. And as for the fifth one here, I just stated that these online mediums also allow for more quick and informational networks. Just considering the nature of the internet itself, it is pretty easy for certain information to be transmitted in a really short period of time. And because of the global reach of the internet itself, it has been really good and accessible to reach as many countries and just areas as possible. And the last one I have here is being able to form those like-minded groups and even create projects as a result of that. So you'll see, if you've been part of the neolth community for a while, that is exactly what the ambassador program is about. So we've been able to connect many ambassadors from different countries and different states together. And through these subcommittees, we can also release and work on a bunch of different projects that relate to a separate like facet of mental health, whether that's in outreach, creating social media content, the career-related aspects of mental health, and so much more. So just branching off of that, I just wanted to give a few examples of really good mental health platforms that have a pretty exceptional online presence. So the first one here is the Jed Foundation, and they say that they try to mobilize communities through a lot of different online activities, such as producing toolkits for students and just young people in general. Being able to showcase the lived experiences of young adults so that people can really just have a better grasp of what other people that are similar to them may be going through as well. And they're also able to engage those with platforms, so think people like celebrities and like influencers, to also use that platform as a way to encourage progress in mental health movements and as a good way to influence young people in a positive manner. So the second one I have here is the mental health literacy website. And this website is really focused on disseminating various mental health toolboxes, particularly for young people, as well as being able to give emergency contacts and creating readily available wellness resources to implement in classrooms. So as you can see, it benefits both educators and students with the resources that it offers. And the last one I have here is the IME platform. And I thought this was also a really good one to mention because most of, or rather all of its operations take place online, and it contains a lot of guides and specific topics such as stigma and gender. And this is also centered around helping LGBTQ plus teens learn more about and validate their identity, especially as it relates to their mental health, because again, they are so interconnected with each other. So these three platforms are really good examples of how they've been able to connect the benefits of digital features with amplifying the mental health movement. So I also wanted to talk about social media and wellness. And the four concepts on this slide are really just a very general overview of the different effects that social media has had on people's mental health. And I wouldn't say this is the most comprehensive list, but I think it does give a pretty good insight into how social media brings about these like negative mental health effects in some people. So the first one I listed here was comparison. So as many of you already know, a lot of users may develop that tendency to compare themselves or their progress or even their personal characteristics. So I feel like some of the most common ones online may be physical appearance as well as career-wise, which also leads to things like imposter syndrome because people may think that their accomplishments aren't as much as another person, or they may feel that they are undeserving of an accomplishment. So for characteristics like this, a lot of people will tend to compare themselves to individuals that they consider to perform at a relatively higher standard than them. And of course, this is subjective. So because of this thought process, it often leads users to think that they are behind that person that they consider to be at a higher level than them, or they may even think that they are subpar or they're just not enough. They may think that they need to do significantly more in order to catch up to them, which can obviously put a significant mental strain on them. The second one I have here is just omission, and I think that this is also a very general concept because what I mean by omission is that a lot of individuals online, especially on social media, will typically feel more inclined to only post about the positive moments that happen in their life. Or if it's not the positive moments of their life, then they may also take an extra measure to hide any shortcomings that they may experience, whether this is just by voluntarily like not reporting any negative moments that happen in their life, or if it's something that has to do with their physical appearance, they may also take part in editing certain qualities out of the picture to make it seem like they are more like enhanced than they may actually seem in real life. So because they are purposely getting rid of some of these negative qualities about themselves, it often gives off that idea to the public that their lifestyle is perfect, and that other aspects of their background are perfect as well, when this is obviously not the case because everyone has their own like flaws and faults that they may not choose to like report online. So users are essentially not getting that full picture. So for the third concept I listed here, it's the fact that a lot of people do tend to romanticize different things as it relates to mental health. So this could also be referred to as sensationalism. So popular culture has leaned greatly towards glorifying different mental health conditions, and this ultimately leads to some users thinking that some of these conditions are desirable in general, or they may intentionally leave out certain details about the reality of such conditions, such as what a patient may need to go through and different symptoms and other things of that nature. So because of this, it really just paints the image to other people that some of these conditions and experiences and environments may appear less severe than they are. And as a result, I feel like on that social level, people may not take it for as serious of an issue as it is. So again, this can be harmful not only to users that are going through a specific event, but just how it's perceived in general and how it's ultimately treated by users. So for the fourth one here, I also mentioned that language can be a really big barrier in social media and how different mental health conditions and just environments are conveyed to others. So language is obviously very nuanced. So users must generally ensure that they're speaking in an inclusive manner and making sure that they're not trying to stigmatize like others' experiences or just mental health as a whole. And it's better to be transparent oftentimes while still protecting the privacy of individuals, you know, like making sure that you're not disclosing any personal information that another person may be like uncomfortable with you disclosing if you are choosing to share about another person's experiences, and also just protecting the privacy of yourself because you do not want to disclose any information on social media or just any type of digital platform that may ultimately make you feel uncomfortable in the long run. It is important to realize that you have the final say in what kind of information you want to disclose to other people. And if you're not comfortable yet, then that is obviously your choice to kind of wait a little longer and make sure to only reveal it when the time is right for you. So as I mentioned for the last statement in the language section, I said that you should always do so in a way that makes all parties comfortable and making sure that you're not jeopardizing anyone in the process. So I also wanted to talk about how we can combat some of these negative effects of social media. And on the right over here, we can see that some common consequences of the 4 concepts that I mentioned in the last slide include things like imposter syndrome. So this is prevalent, especially in things like professional and personal settings. As I said, people may feel like when they have imposter syndrome that they're undeserving or may not be on that same level as other people. So that ultimately causes them to undermine their accomplishments and feel like they didn't really do that much. Another consequence that's really big in social media is just that fear of missing out, because a lot of people as a result will feel as if they're being excluded, as if they're not really fulfilling like some like part about themselves, or they're not really attending to like an event. Another consequence here can be things like depression and anxiety, social and emotional isolation. So they will tend to like not really interact with other people as much. And this can also be shown through things like their emotions. They may not also like attend to their feelings and emotions as much and may seem emotionally detached from themselves. Another one here is having increased issues with body image, because as I said, people will tend to try to portray the best version of themselves online in both a physical and other, I guess, like aspects as well. And another one here can be disordered eating, which is also connected with increased issues with body image. So kind of bouncing off of that, the first technique that I put here to combat these negative effects of social media would be to limit consumption. This is probably like the one that probably has the most effect, because you can moderate the time that you spend on apps and avoid or at least limit your viewing time for certain topics that you may feel uncomfortable facing. So if you know that it's going to make you like in a state of like distress, then it would probably be best to kind of stay off of it as much as possible or just avoid it completely. So especially in younger users, it may be better for parents to set restrictions for younger individuals, because the parent is there to kind of help their child through certain situations like this online. So the second one that I have here is just to realize that social media is a facade. So obviously, as I said, not everyone is truly showing like the most transparent version of themselves online. The things they post tend to be very selective, and they'll only post things that, as I said, illustrate them in the best light possible and kind of overlook negative aspects about it in any way. So yeah, as I said, a lot of users will purposely reject content that paints them in a negative light. So in a way, social media will kind of like skew like users towards only looking like in a positive way. And the last one I have here is just to practice other forms of self-care that don't really have to do with like technology or like a digital platform in general. So it's also good to balance your time towards productive activities and different exercises that don't require technology and extensive like viewership online, especially to focus on your personal progress, because I feel like that there are a lot of ways to balance other aspects of your life without the use of technology or other digital platforms. So it's also good to invest in those types of techniques and activities as well. So I also wanted to talk briefly about some of these gaps in the social media scene, because I think that this does provide a really good foundation for how technology and mental wellness and that intersection, really just like how it'll develop even more in the future. So this is just like a list of like some questions that some researchers are still referring to guide some of these studies, and some of these findings can really be a really big advantage for how to control digital platforms in order to like improve mental wellness and make sure that it isn't harming users. So as it says on the side here, when improving the technology-infused mental health scene, further research can support more effective and ideal approaches to balance social media use and wellness. And obviously, a lot of extensive research is still being conducted to ensure that findings fill in various blind spots in global social media studies. So as for these blind spots, what I'm really referring to is that researchers should make sure that they're accounting for as many different like social media like content and like topics as much as possible, make sure that they're accounting for many different demographics and backgrounds, and making sure that they're also accounting for different devices, because a lot of these interfaces and features can vary from device to device, such as computers, tablets, smartphones, and much more. So it really is good to kind of keep track of all of those three categories combined. So the first one I have here for a gap or like a question that a lot of researchers are still pondering over is what type of content is the most harmful? So the point of this question is really just to target specific topics that might prove to have the greatest impact on impressional minds. So this can be defined by how significantly a user will view it as an issue, or it could even be how urgently they feel they must establish a change to themselves. So the second one I have here for a gap is, are there any specific devices or features that produce the most effects on a person's mental state? So obviously this does require a lot of back and forth with different trials, because there are so many different features and devices and other aspects like that that researchers and even like corporations for these different programs have to consider. So I felt that this was also pretty significant because it also overlaps with one's internal reward system. So it can also overlap with things like instant gratification and the frequency or time spent on a certain device, because greater accessibility to certain devices, such as your smartphone, because everyone has that on hand, essentially it means that that user will be more likely to engage more with different apps. So that could also be a really huge factor as well. The third one I have here is, how does in-person versus online socialization affect a person's mental health differently? So obviously in-person interactions versus online interactions do have very different components to it. And with this question, it will look into the many dynamics, especially on that social level and individual level, that are influenced by the different characteristics of both settings. So this can include things like isolation, because for an online setting, although you're technically in contact with someone, you're not actually facing them in person. So if you're like socializing from like an online setting, you're not really like in the same like area as someone, like you're still pretty much like physically isolated. And yeah, this question also overlaps with inherent social connection, just because I'd say it is pretty much easier to do in-person interactions because you are already developing that connection with that person. And it would be a little harder, I'd say, to really develop as strong of that connection online, because again, you are not facing them in person. But I'd say that this argument could go both ways, because online you do have more access to different users. So it kind of balances out in some sense. The fourth one I have here is how our reward systems and life satisfaction connected through social media and mental wellness. So I would say a lot of researchers have said that this looks more at like a biological lens of the mental health and technology issue, because such issues are also connected with things like addiction, behavioral health, and as I said, instant gratification. And the reason this is such is because social media is highly accessible. It is simply just there on like your smartphone or like a computer. So you are getting that like instant pleasure no matter what. And the last question I have here to really guide on the social media scene and the research that is going on around it is, what mental health related community level factors arise, and likewise, what kind of social factors arise, individual factors, organizational, and political. And as we all know, this topic obviously impacts the functioning of society on a lot of different levels, as many decision makers and stakeholders must be involved in its changes. So with that said, I just wanted to talk briefly about the different roles and different things that people can do, so stakeholders and communities, to kind of have more of a control on digital mental health. So this is kind of more like social media oriented, but I'd say that from a general perspective, it could work. So for young people, it is pretty beneficial for them to impose boundaries if needed for platforms like social media. So that could be in the different apps that they access, or the different time that they decide to spend on an app, on the different topics that they choose to explore, on the different exercises that they try to do, and a lot of different applications like that. A lot of young people should also try to practice more healthy habits and recognize strategies that best work for oneself. Um, it is good, obviously, to refer to different resources and gain suggestions from other perspectives, but ultimately that person is in control of what works best for them because they know their mind the best. From a parent point of view, it is pretty good to put together an agreeable media plan for all family members with proper restrictions as needed. So as for this media plan, what I mean by this is that they can impose different restrictions on what type of content their family can watch, or the different time restrictions that each person can have on different devices or different apps or different channels, basically things like that. And parents also have that responsibility of teaching more impressionable minds about the factors of online platforms, making sure that they're not accessing negative content that could affect their mental health in different ways. So as for the educator's responsibility, it is also good for them to develop and provide an enriching curriculum for students to refer to in order for them to better understand how mental wellness is affected by these digital platforms. And I would say that they could also work in tandem with policymakers as well, which I'll touch upon in a moment. And for companies, they have a lot of different roles as they are in charge of releasing these different digital platforms and social media apps. So that what they can definitely do is investigate the many sides of mental health. So population-based. So this could be things like different populations, like backgrounds and things like that. And they can also look at it from a community level and specific features of mental health. And they can also research existing gaps in what is and what is not appropriate for online platforms. So really just looking at the different time spent on an app and how that may affect a person, the different content that they choose to release to the public and how that can affect a person's mental wellness, as well as strategies for different ages, because a lot of different age groups do respond to different content and features differently. And lastly, we have the role of policymakers. So they have a lot of different obligations and roles that they can be taking up in connection to other stakeholders such as educators and companies. So in general, they can work with these companies to ensure that all of their data is protected and that platforms are made with the best interests of users in mind. So this can really just take from the data that researchers also collect. And policymakers can also inform researchers and companies about the different policies that are put in place in order to protect things like their data, like their privacy, confidentiality, and things like that. So here are some examples of technological mental wellness options that have had a spot on the market. Some of them are fairly new, but some of them have been around for a while. So an example of a new one is actually prescription video games, and this has been used specifically for conditions like ADHD. So these video games will have an ultimate focus on improving a child's focus, decision making, and impulsivity through the different features and settings that they offer in that game. So another one is digital pills, and this one is fairly new, but it hasn't really expanded much yet in terms of its popularity and its actual use on the market. But the digital pills for mental wellness specifically is to make sure that that patient is ingesting the proper amount of medications that they should be. Another one here is simply symptom tracking. So it's pretty self-explanatory, but patients can essentially input the different symptoms that they may be experiencing, and they can also be offered different individualized suggestions, or just simply make sure that their treatments or symptoms and other things they're experiencing are being effectively tracked and recorded. So telehealth has been a very popular option, especially because of the pandemic, and really just making sure that people still have that bridge to a provider that they can really connect with, even in spite of some of these distance related barriers. And we also have wearable technology. So as I mentioned, this can really be things to track different biomarkers. So an example, of course, is digital technology that you can wear on your wrist to kind of record different aspects of your lifestyle. And the last one we have here is obviously apps. So neolth has been a good app that a lot of you are familiar with already. So we can already see how that works and its flexibility for a lot of people. So, as part of that technological aspect, I kind of wanted to also dive into discussing AI, so artificial intelligence, as well as virtual reality in healthcare, because I thought that because these two fields are growing pretty rapidly, it would be pretty interesting to kind of include in the discussion as well. So, as I noted on the side, it's very critical to note that although many technologies have had a pretty good success rate in approaching a user's mental health, so however that may be, it doesn't really fully substitute the perspective or advice of a medical professional. Of course, these technologies are still rising, and a lot of refinements still need to be made to them. So as for artificial intelligence, so AI, there are a lot of different like apps and a lot of investments in research that have attempted to monitor users' mental health states, or rather the severity of their conditions, through different biomarkers. So some biomarkers that I've actually seen incorporated into some of these apps have included things like the tone of a person's voice and even things like movement. As for virtual reality or VR, so the whole point of VR is to just like rewire that person's mental or biological pathways as well. And this is a fairly new yet promising concept because VR has proposed uses in therapy settings. So, for example, a patient would have repeated exposure to something in order to alleviate conditions like anxiety if those two are connected with each other. It also has uses in regulating one's nervous system. So, for example, through pleasurable environments that the person may benefit from VR, as well as introducing patients to environments that simulate their actual lifestyles as well. So, because of that repeated exposure, then they will have a relatively better success and efficacy rate as a result of VR in their therapy. So, with all of these points of like digital wellness platforms, I also wanted to kind of go over the benefits because as I mentioned that this field is a double-edged sword, it's also good to shine light on the advantages of these different online platforms for mental health. So a lot of these mental health apps obviously do offer a lot of personalization for different features and exercises. So if a person expresses interest in a certain exercise, or if it finds that they're sticking to a routine that works best for them, then it will automatically personalize it based on, as I said, user activity and their expressed preferences. So in things like telehealth, as I kind of mentioned briefly before, there are a lot of community level benefits from telehealth because the patient doesn't have to seek transportation. So it automatically removes that barrier because all of it is done solely over like a smartphone or like a telephone. And it can more and the patient can more easily access culturally competent providers because they don't have to worry about distance being a barrier. Because it is all online, then they can seek providers in different areas as well. And as I said, physical distance doesn't have to restrict them from being able to be under the care of that provider. So digital wellness platforms, because it is done solely from a cell phone or like a computer, that means it is accessible on a daily basis as long as that person obviously does have that device around them. So because of that, these platforms can be used during most times of the day, which is helpful for things like crisis support. And lastly, a lot of these platforms do have built-in service finders as well. So this can be in-person service finders or even virtual resource finders, where they can access different databases, resources, and other references that that app finds to be beneficial for people when managing their mental wellness. So there are obvious concerns and disadvantages because it is essentially using your data in order for the app to even function and tailor itself to that user's preferences. So the first one we have here is a pretty big one, which is confidentiality. So of course, for things like a health-related app, users want to ensure that their data is only being used for the purpose of that platform that they're engaging with. So obviously that would be things like health management, symptom tracking, doing different exercises, getting personalized suggestions, and data, including that person's health histories and treatments. All of that data must be secure when used for providers and plans, and it shouldn't be in the hands of other individuals that shouldn't have access to it. So another one that's pretty interrelated with that is obviously privacy. because individuals can feel uncomfortable when disclosing certain information, especially if it is online, because a lot of this information is very precise and identifiable to them. And of course, as an implication, legal issues can arise if such information is used to conduct inappropriate activities or is being transferred to someone that shouldn't have possession of that. And the last one here is that because all of this is taking place over a virtual platform, there are a lot of restrictions with technology's abilities. And what I mean by that is that technology really just lacks the empathy, authenticity, and cultural understanding that a patient-provider relationship effectively and naturally provides. So because technology doesn't really have that ability to form that certain type of connection with its user, it is obviously lacking in that part there. So as for looking to the future, obviously these digital platforms will continue to increase and develop even more. We can only predict that it's going to become even more advanced, judging from the progress that's already been made with different technologies and how it has connected to mental health. So as it says on the slide, a lot of revolutionary research and clinical trials in mental health, online platforms, and social behaviors, and how they're all connected with each other. That's definitely going to be something that is increased even more throughout the next few years, because it doesn't only apply on an individual level, but it also applies on things like a community level, political level, an organization-related level, and so much more. And secondly, there's going to be a lot of refined technology that is developed over the course of these next few years. It's definitely going to revolutionize the digital era even more, especially with artificial intelligence and using biomarkers and other aspects of a person's background to really just assess the severity of a mental health condition. And again, this probably won't be like the forefront of medical treatment, but rather a supplement to it, because there are some things that simply just cannot be replaced by technology in that sense. And lastly, we have that in the future, there will definitely be more improved guidance on how corporations, apps, and other related stakeholders can protect both the wellness and the data of the users without compromising anything such as their privacy and confidentiality. So because we are talking about looking to the future and how the mental health movement will grow from there, I also wanted to talk briefly about digital health advocacy, especially as it pertains to the mental health movement, because I think that having the voices of a lot of different advocates and stakeholders and young people obviously will have a really big and beneficial effect. So as I mentioned earlier, it's always good to use inclusive language when talking about an issue like this, and obviously be mindful of what others are comfortable with. And of course, if you are choosing to share about someone's experiences, definitely gain their consent first and only talk about it in a way that is acceptable and doesn't exclude them or stigmatize them. And as it says here, from a general perspective, don't stigmatize the field or undermine others' lived experiences. This also goes without saying, but definitely do not make comparisons, because I feel like when you do make comparisons online, then it kind of does tend to undermine another person's experiences or views as well. So definitely be mindful of the audience that you're speaking to and the points that you're even talking about. So as it says here, it's also good as a digital health advocate to collaborate with different organizations and mental health campaigns to, again, amplify these diverse voices and take part in hands-on work. So talking about hands-on work, I also wanted to talk about neolth and how the company is generally being a really big catalyst in the mental health movement as both a virtual platform and in even fostering a student community. So as I mentioned, neolth is really good because it democratizes accessible and easy to use mental health services for all individuals through a common device. So whether this is your computer or even just your smartphone, and because it is taking place over such a swift and easy to navigate network, then it's able to reach a lot of audiences and just demographics in general and many global areas. So just considering the combination of both the main app or just the main technological platform, as well as neolth's extensive community network, It also increases student trust, engagement, and awareness as a mental health resource because students are able to see how they can both contribute to the mental health movement and how they can also gain benefits from it by using neolth. And both platforms, neolth as a digital tool as well as neolth as a community, both of these together encourage young folks to enrich themselves and balanced mental health routines and knowledge. And again, neolth is a really good way for a lot of students to supplement their lifestyles. And lastly, a lot of young people do benefit from the app itself. However, they can also take part in advocacy directly while working with a lot of like-minded teams. So I definitely think that neolth is a really big pioneer for both of those aspects. So again, just to reiterate, as an accessible digital tool, neolth has a lot of personalized features to maximize the impact of different exercises and practices that users engage with. And users can really just make the most of their experiences according to what works best for them because of these different features. And as for neolth being a really good way to foster that community of mental health advocates, a lot of students have found that they can make use of neolth's international platform to reach just as much as an expansive audience and a lot of different and diverse groups. And with the different offerings of like subcommittees that the company has, it also allows students to explore the many facets of mental health and really just make sure that they can maximize their different skills and interests as much as possible. So I'm just going to play a quick 2-minute video about what neolth is and how exactly neolth and the student community really just contributes to the mental health movement as part of being like a digital platform and community as well. All right, so that pretty much concludes the event. So definitely with all the information that I mentioned, you can all keep in mind that if you're interested in working with neolth to further your mental health advocacy efforts and just generally work with a digital community that has just as much of an impact within the mental health field, then you can definitely feel free to contact us with the email addresses below or even in the Slack or just any platform that works better for you. And the ambassador application is here as a QR code, and it's also on the neolth website as well if you'd like to explore that even more. The code for the free trial is also below the QR code if you're also interested in looking into a free trial as well and really just experimenting with the app, as you may need to supplement your mental health needs. So yeah, that is all for the event. And as I mentioned, definitely let us know if you have any questions or other comments about the event or neolth in general, or how you can support the digital mental health movement. So yeah, you can feel free to do so in the chat or email, or during whatever platform works for you.